Hello, I'm Cody Christopher, and I work as a hospital staffing surveyor in OHA's hospital staffing program. OHA's hospital staffing complaint system is how Oregon's hospital staffing law, including the updates in 2023's House Bill 2697, are enforced in Oregon. In this video, we will guide you through the hospital staffing complaint form by explaining frequently misinterpreted questions. This guidance will help you make sure the information you provide is the information that OHA needs to determine whether your complaint is valid for investigation. These complete answers reduce the need for follow-up questions. The complaint form has been updated in preparation for elements of the law that went into effect on June 1st, 2025. Hospital staff members and exclusive representatives can access the complaint form link on the Oregon Health Authority's hospital staffing website at www.healthoregon.org/hospital staffing. When you click the link, you will be directed to the hospital staffing complaint portal built in SurveyMonkey. The complaint form portal will ask you specific questions about the nature of your complaint to help direct you to the form you need to submit your complaint. OHA has designed different complaint forms to collect the specific information needed to process complaints about nurse staffing, professional technical staffing, and service staffing, as well as complaints about missed meal and rest breaks, which are forwarded to the Oregon Bureau of Labor and Industries, which is also called BOLI. Once the portal has helped you identify whether your complaint is related to nurse staffing, professional technical staffing, service staffing, or missed meals or breaks, the portal will present you with a link to that category's complaint form. Using the complaint form, each allegation of noncompliance is submitted as a separate complaint. This means you will need to submit a new complaint for each distinct allegation of noncompliance. In the next slides, OHA will provide explanations for frequently misinterpreted questions in the complaint form. These clarifications are intended to provide more information about the questions being asked and what kind of information OHA is seeking in response. Examples on the next slides are taken from the nurse staffing complaint form, but the clarifications also apply to the professional technical staffing and service staffing complaint forms. Please note that while these are actual questions from the form, the questions may be numbered differently when you submit a complaint due to skip logic on the form. Most complaints will need you to identify the unit where the alleged noncompliance occurred. As you can see above, the question asks for the unit name, the full name of the unit spelled out, and the unit abbreviation. For example, if the complaint involves the medical surgical unit on the third floor of the hospital, the unit identification questions should be completed in the following ways. The unit name as Med-Surg 3, the full unit name as Medical Surgical Floor 3, the abbreviation for the unit as MS3. If there are multiple units with the same or similar names, the complaint should clearly identify the location of the unit, such as the floor number or building that the unit is located in. Some hospitals further specify the part of the floor where the unit is located on, like 3 West. If that location information is used at your hospital, it should be included in the unit name on the complaint form. Regardless of the type of complaint you file, you will need to identify when the alleged violation occurred. Enter the date using the MM/DD/YYYY format. For example, if the alleged violation occurred on June 1st of 2025, you would enter 06/01/2025. A complainant has 60 days to file a complaint. A complaint about an overnight shift should list the date of violation as the date on which the shift started. To learn more on this topic, OHA has a short video explaining the problem of future complaints and complaints filed mid-shift. If you allege that the hospital failed to follow a staffing plan, you will need to tell OHA what the staffing plan requires. For example, if a complaint alleges the hospital failed to follow the ratios in a nurse staffing plan, the complainant will need to indicate what the required ratio is in the nurse staffing plan, as shown on the slide. In some forms, you will be given a drop-down box with an Other option if the required staffing level isn't included in the drop-down menu. Because of the variability in staffing requirements, some questions have a narrative box instead of a drop-down. If you see a narrative box, please clearly describe the requirement as it is written in the applicable staffing plan. Similarly, for complaints that allege failure to follow a staffing plan, OHA needs to know the actual staffing level on the date of the alleged noncompliance. For example, complaints about failure to follow the ratios in a nurse staffing plan includes a question that asks how many patients were assigned to the RN or RNs with too many patients. To determine whether there was a failure to comply with the nurse staffing plan, OHA needs to know the total number of patients assigned to each RN who had more patients than the staffing plan specifies. So, if the ratio was supposed to be 1:4 and the RN had 6 patients, then the answer would be 6 because 6 is the total number of patients that the RN had. For the complaint to be valid, the number of assigned patients must be greater than the RN to patient ratio specified in the previous question. Similarly, some staffing plans specify minimum numbers of staff on shift rather than staff to patient ratios. The questions for these situations require an answer that specifies the minimum number that is written in the staffing plan. The next question in that series requires an answer that specifies the number of staff that the unit actually had on the date of the alleged noncompliance. For more information about hospital staffing requirements and hospital staffing resources, such as FAQs, webinars, and hospital staffing shorts, we invite you to visit the hospital staffing website at www.healthoregon.org/hospital staffing. Thank you.